This is Dr. Sharma from Colonel's Dental Spa, Bangalore, India. Fitting of the crown on a natural tooth follows certain sound engineering principles. It also means that the preparation of the tooth, which means the grinding of the tooth, which is commonly known, which is done by the dentist before a crown is fabricated or the impression is taken, this preparation also should follow certain guidelines. For example, if I make it very simple, the walls should be parallel to each other. There should be certain retentive grooves which can be prepared on the tooth surface. The height of the tooth also is a very important factor for the retention of the crown. In certain cases, the height of the tooth may be pretty small, where the tooth structure is not sufficient for the crown to take retention. In such cases, the crown may keep falling off. There is a myth at times that the crown is glued onto the tooth surface, and the patient, when the crown comes off, the patient might come and say that, "Doctor, you have not used a proper good quality glue." Now, the cement that is used to fix the crown on the tooth surface is not for retention. It is primarily for sealing of the margins around the crown. But in the last few decades, adhesive dentistry has seen a lot of research and development. And nowadays, a crown, certain types of crowns, can also be bonded on top of a tooth structure, which helps in retention. Sometimes the structure of the tooth on which the crown has to be fitted, that structure of the tooth itself is insufficient. So it is the knowledge and the expertise of the dentist to take a call whether a crown, a successful crown, can be fabricated to fit on the tooth surface. Crowns are generally fitted on the teeth using a luting cement. Now, sometimes the crown can come off because of some kind of a sticky food which we eat, which can pull the crown away from the tooth. In such cases, the crown can be refitted very simply by the dentist. Now, it is commonly seen that falling off of the crown is also accompanied by the fracture of the tooth also. At times, the patient may feel that the crown has fallen off. Actually, the tooth itself is fractured, and in such cases, the crown cannot be fitted back. Such cases may have to go in for either a post and core, where the crown is built up again, that also under certain guidelines. And in such cases, tooth can be removed and an implant can be placed instead of that. At Colonel's Dental Spa, we specialize in taking a call whether the tooth on which a crown is to be fabricated will stay for a long time or not. And then we explain to the patient in very, very clear terms, and then take a call whether the tooth should go in for a crown or it should go in for removal and for an implant instead, for better results of our patients.